Perfect. Well, welcome everyone, and thank you for joining us at the Heart Association, American Heart Association the Center for Health Technology and Innovation. Today, we have myself. I'm Dean Mitchell. I'm going to flip over to the next slide so you can see our pictures. Dean Mitchell, Strategic Business Lead here at the Center for Health Technology and Innovation. We have Ms. Cassie Walker, Program Director of Doctors with Heart here at the Center, and Dr. Pat Dunn, who has led the development of the Center's Connected Heart Health Care Plans and Digital Health Coaching Platform, our Intelligent Health Solutions. So today here at the Center, we have created a medical innovators network that we facilitate. We are providing a platform for the cutting edge science of the American Heart Association and the American Stroke Association for collaboration in clinical outcome studies, networking events, for connecting clinical outcome specialists, potential sponsors, and funders. We are working in several different areas, so we're glad everyone's joined us today. We are working in digital therapeutics, health information technology, devices and sensors and wearables. And we have been seeing tremendous growth in this area. We have personalization of healthcare for the individual, and Dr. Dunn will lead this discussion for us today. We are also working in the telehealth sector and its various iterations, artificial intelligence and voice and apps and data. As we move forward with our audience, if there are questions, we will field your questions at the very end of the presentation today. There is a chat box on the screen for you to type your questions. So moving forward, Cassie, as leading the Doctors with a Heart initiative here at the Center, we know there are many social determinants of health. The minority and low socioeconomic communities are under-resourced. They face unique barriers when it comes to healthcare, and alarmingly tend to also be at highest risk for cardiovascular disease and other health issues. If you would, can you give us a quick broad stroke on the Doctors with Heart initiative here at the Center?
I'm always excited to talk about Doctors with Heart. We just launched the program a few months ago, and it's really designed to improve access to specialty care, namely cardiovascular care. So Doctors with Heart is designed to connect community clinics and federally qualified health centers, or FQHCs, that have these underserved populations with we like to call them our army of cardiologists, who are really members of the AHA. They're our volunteers via telemedicine. So these consultations that we're planning are going to be doctor to doctor. So mostly when you're thinking of telemedicine these days, you're thinking doctor to patient. A patient gets online and can see their physician. But in this case, these are doctor to doctor consultations. So you can think of it, I like to think of it as a hallway conversation between two doctors, one being the primary care doctor in the clinic, and the other is a cardiologist, one of our AHA members who is volunteering their time. So, in short, when the patient comes into the clinic, the primary care doctor will treat them as best they can. And then sometimes, though, that primary care doctor would really like to speak to a specialist, in this case, a cardiologist, about the case. So after the patient leaves, the program is set up for the consult to be scheduled and then later conducted via our telemedicine platform. So that way, the patient, we're not trying to coordinate while the patient is in the clinic. Really, it's a doctor-to-doctor consultation. And then if the patient needs any additional information or something has changed in regards to their care, the patient can be contacted later. So we're ramping up right now, launching with a pilot program this year. We expect to start consultations this summer, and then we'll be looking to scale it up and expand it nationwide. So really exciting program. And if you have any questions about it, please feel free to type those in. We'll also give you an email address at the end of this presentation, and you're welcome to fire off any questions into that email address. We all receive those. So happy to answer any questions you have. But why don't I go ahead and turn it over to Dr. Pat Dunn, who's going to walk us through the rest of the program today. Pat?
Well, that was great, Cassie. Yeah, thank you.
Yeah, thanks, Cassie and Dean, for the wonderful setup. So I was just looking through the attendee list, and I see some familiar names. So thank you for joining. And as Cassie said, please feel free to use the chat as we go through the presentation. If you have any questions, we'll attempt to address them either while we're speaking or certainly by the end. We really are standing on the shoulders of the entire organization within the American Heart Association. Our leadership, all of our amazing staff and colleagues that are doing amazing things, across the spectrum of health and cardiovascular disease. And then our network of volunteers, who some of those are clinicians, some of those are literally, volunteers that help us out in the community. So, these are both scary and unusual times, but we think we all recognize that, the health tech and innovation is kind of here to stay. And, we're kind of privileged to be kind of at the forefront of that. So I'm going to speak to a specific part of what we do. But as Cassie mentioned, with the Doctors with Heart, we're increasingly getting into many other areas of health and technology. As you can imagine, the American Heart Association is interested in virtually all aspects of cardiovascular health and disease, from science discovery to translation to having better diagnostics and treatments. Our center tends to focus on the bottom two, the at-home and the care transitions. Although, obviously, if we do those well, they actually hit all of these other areas as well. So the premise and the purpose of our center is really to kind of reach out to the tech world. We're kind of the tip of the spear, the connecting point between the innovators, the technologists, the developers, and the clinical, scientific, and research world. And, it's no small feat because these two industries tend not to speak the same language. So we literally are a translation from that perspective as well. But what we're trying to do is really help the tech world achieve a basic promise and a basic premise that technology can result in better health and better healthcare outcomes. Specifically, increased engagement, improved health outcomes, and if we do both of those correctly, should lead to lower cost. But we know there's a lot of work. There's a lot of amazing technology, and there's a lot of amazing things going on in the healthcare space. And sometimes it just needs, connecting the dots to really get the best bang for our buck in how we deploy these technology solutions. So what we have, one of our strategies for doing that is what we call our Innovators Network. And this is basically our way, the American Heart Association as a not-for-profit, of working with for-profit technology platforms as well as healthcare providers and systems. Basically what you do is this is a consortium, really focused on the health tech space. Why would you do that? What are the benefits? Well, first one is just collaboration, on outcome studies. There's a research agenda really built around health technology. As many of you on this call understand, it's very challenging to do really the same type of research using the same type of research models with health technology that you would for example, a pharmaceutical. It's much easier to control a compound than it is a solution that's highly innovative and wants to continue to innovate. So that's part of what we're trying to do, is really trying to help and solve those challenges. It becomes amazing networking opportunities. Our signature scientific event is Scientific Sessions, which is every November. You know, a lot of the conferences have been kind of put on their ear a little bit by COVID-19. We're hoping by November things will be back to usual, but you know, it may include some virtual as well as on-site sessions. This year's Scientific Sessions, is going to be in Dallas. It's November 14th through the 16th, and it is a way for the innovators in our network to meet and network with our leadership and our clinical scientific volunteers. You also get a press release, which we help you create, but you're the one that actually releases the release. But it's an announcement, you know, sharing to the world how your organization is working with us and with the American Heart Association. You know, and of course, there's guidelines on use of the brand. You know, you can't just use our brand without permission. So this is a credible, legitimate way to do that. And we also recognize you on our website, and we'll show you, you know, kind of a slide with our innovators. But we do have a website, and maybe Cassie or Dean, you could pop the URL to our website into the chat area. It's ahahealthtech.org. And in there, you can see who all the current Innovator Network companies are. Here's just some of the examples. Some of these are screenshots from our scientific sessions, you know, with literally the best of the best minds in healthcare, in cardiovascular care, and also in technology. Last year in Philadelphia, we conducted 26 sessions over 2.5 days. We had presentations, we had panels, we had demos. All of our innovators were invited to participate in the session. We had HIMSS TV there interviewing everybody, and those interviews are also online. We can send you a link to all those interviews as well. But again, you know, it's just an amazing way to kind of connect and network with those people. There's no shortage of topics and problems in healthcare, everything from blood pressure to atrial fib to cardiac rehab to cardiometabolic disorders. And there's also no shortage of amazing technologies that can help solve some of these problems. And again, we're kind of that connecting point, you know, trying to help, you know, the clinicians, the researchers, and the scientists figure out what technology is out there and what technology really can yield the results that they're looking for. So again, that's another reason to be working with us in that way. So here's our list, current, and literally, you know, Dean is such an amazing, he's a very humble man, but he's an amazing leader on our team, and he's going to force me to go to 2 slides here pretty soon because he keeps adding companies to our network. So it's amazing. So this slide used to have, you know, really big logos to fill up the space, and the logos keep getting smaller and smaller as we go. So good job, Dean. Thank you for all the amazing work you're doing. And as you can see with this is a very diverse group of companies. Some of them you may have known or heard of, and some of them you may not have. But they really, you know, they range a variety of areas of specialty. You know, more traditional remote patient monitoring systems like Livongo, ones that are very much in the biosensing wearable space, like a BioIntelliSense. Some of them are using robotics, like a Catalia Health. Several of these companies are really in the mental health space, you know, realizing that there's the connection between cardiovascular and mental health. So Happify, Total Brain, and Teatros are 3 examples of that. Almost all of these companies in some form or fashion have some sort of mental or behavioral health component, because you can have amazing technology, world-class science, but if people aren't using the system or just not engaging in their health in any way, then it's a lost opportunity. So again, almost all of these companies have some some area where their technology is just amazing. So I'm going to shift gears a little bit into the area that I focus on, which is our intelligent health solutions. And I have to get used to saying that name. We used to call it the AHA Inside, and before that we called it Connected Heart Health. Those names have become a little bit obsolete. But in the intelligent health solutions is really kind of a better depiction and description of what these are. But basically what we're doing, because we're a science-based organization, we're not a technology company. So we're really kind of trying to stay, in the area that we are really good at, which is the science and the translation of the science. So what we've done over the last decade is develop a series of what we call care plans around a variety of cardiovascular solutions, post-acute conditions like heart failure, stroke, coronary artery disease, and atrial fibrillation, as well as more chronic conditions like hypertension, diabetes, high cholesterol, and even up to and including childhood obesity. So what we do is we take those guidelines and scientific statements and translate those into actionable plans that people can actually understand and act on. And then we've taken it a step further and have created a digital coaching platform using principles of health coaching, of health literacy, a digital version or form of motivational interviewing, and making all of these highly personalized in a way that people are much more likely to adopt. And again, we translate that into what can be delivered through a technology platform and viewed or accessed on a mobile device. The personalization really comes from both dynamic factors like the individual's readiness for change, their self-efficacy or their confidence that they can actually be successful, and their level of literacy, how knowledgeable and how, what kind of knowledge and skills do they have in managing this condition in the first place. All three of those concepts are dynamic. We want to build those. We want to take a person from not ready to ready, from not confident to confident, and from not knowledgeable to knowledgeable. But there's also static factors that really kind of define the personality and literally the signature of the individual. And these things tend not to change. How are they proactive or reactive? Are they self-directed, or do they kind of need to be pushed into this? Are they goal-oriented or group-oriented? Do they like direction or choices? And are they independent or interdependent? Meaning, are they more social, or do they like to do things on their own? What we can do now is with this digital coaching platform, we can deliver these plans in a variety of formats based on these factors. And this includes not only the type of media, is it an article or a video compared to maybe a text message, or maybe a much shorter form, maybe an audio message. And then also the content of the message itself, is it pretty basic that we can build upon, or is this person already pretty advanced and we can build from a much higher level? So that's kind of what we talk about when we say our digital coaching platform. What that allows us to do is, again, kind of like we do in everyday human life, both in healthcare and in other forms of life, is really kind of figuring out who the person is that we're dealing with. In a healthcare context, what we've done then is we're able to form different, what we call signatures, from your personal and demographic signature. So when people talk about social determinants of health, that's the domain that would fall into. People also have a medical signature, their diagnosis, their the comorbid conditions or risk factors, the medications and treatments, and also their genetics. There's a lifestyle component that includes their behaviors, physical activity, nutrition, sleep. Are they Do they smoke or use tobacco products or vape? And then some of the biometric factors, their blood pressure, their weight, their glucose, and then finally their mental health status. So not only depression and anxiety, but just their level of stress, their relationships, their mood. Again, all of this form a kind of a signature. And then finally your learning style, which is what I mentioned on the earlier slide. So all of these kind of form kind of a strategy. If you know enough about the person, then you can figure out what's going to make them, really what makes them tick and what's going to be most likely to get them to engage. And again, we can deliver these. What we're delivering is not a front end. What you're seeing are examples or almost literally mock-ups of a front end. But what we're delivering is really the knowledge, the intelligence in the back end that can be delivered into any system. And I'll show you what I mean by that here. So we deliver this through what we call our intelligent backbone. So we have all of these content areas, all of these different, we have about 2,000 content assets. And and an asset is everything from a video to an audio, to an article, to a message, to a plan, all of those things, if you add them all up, are about around 2,000. Increasingly, almost everything now is in both English and in Spanish. And it's delivered through a back end, through an API. And that is also one of the benefits of the Innovators Network, is that you do have a way to access those plans. So I'm going to stop here and open up. I'm going to turn it back to Dean and Cassie and anybody else on our team. If you have if anybody else have any questions or comments.
Hey, Pat, that was excellent. The HA is really the de facto standard for the scientific guidelines of the cardiology community. And as you mentioned, we have taken in all the demographics of health, whether it's mental and other, and it has allowed us to operate as a virtual science company for the new technologies that are out there. Mm-hmm. We've got over 100-year history, and even our first scientific sessions goes back all the way to 1925. Mm-hmm. So for us, it's a great opportunity to take that strong and rich history and bring it to the market to help change lives. Cassie, you go ahead and lead off. I'm just jumping in there.
Yeah, and I see Tracy's asking if anybody's talking, so there may be some audio issues going on. I could hear Dean just fine, so hopefully you're all hearing me. If not, I can start addressing some of the questions. Oh, sounds like they're only hearing me. Okay. So Robert had a question about membership details. So Dean can probably follow up on individually. The membership details really are on the slide I had a little bit earlier here. I'll go back to it. So these are the details of the member benefits. And basically it works like a subscription. So it's usually a 2-year commitment. So you basically join the club, and then there's some other opportunities for accessing this intelligent health solutions, which typically is on a like a per user type of a deal. And so Cassie, I see you've addressed the one question. Yeah, we're we look for all different sizes. We're not restricting to large or small as far as clinics. We typically look for tech solutions. So we're not looking directly into clinics. Again, part of what we can do is match the clinic needs with the technology solutions. And so then our input is really through the technology platforms. in some cases, the clinic is the technology platform. Other questions? I see we have got some good conversation going on in the chat area. I do want to mention the part Cassie was mentioning. So, this intelligent health solutions historically has been, kind of the primary area of our center. But as you can see now, increasingly, telemedicine and other ways of delivering information to patients and consumers is increasingly, kind of in our wheelhouse. So, that I think telemedicine is here to stay. It has been here to stay, but there will be more to come. There's a question about the cost. Yeah, Dean can follow up with anybody on the details of actually how to get into our network. And as we're getting ready to close up in a few minutes, just want to thank everybody for their time and attention. I know these are crazy times, and a lot of us are still at home, but that doesn't mean we're not busy. In some cases we're busier than we used to be, and so I know this is 30 minutes out of your day, so we really want to thank you for that, and would love your feedback, your input into this.
Hey, Pat, I know that you can hear me. Let me ask an audience member. Can Robin, I think you just popped on there. Can you hear me? Try type in that. Yes, you can. Okay, great.
Good.
Good. So I think we are recording this. Hey, Robert, thank you very much. I guess we had a little bit of an audio issue going on before. I'm not sure what happened there. So I know Patrick are there any other questions before we close out? We don't want to close out too early, but we don't want to detain you. It's been close to about a half an hour, and we've loved having you here today. Yinka, what we'll do is try and get back to you. And Robert, I'm glad you can hear me, and thank you for letting us know. We're really looking at coming back to you to feature some leading innovative companies and some highly thought-provoking guests in the medical technology sector. Part of the Innovation Center for Technology here, what we're doing is creating a platform to move the digital health sector forward with new technologies and just leveraging our science. So please do reach out to us. Hey, Dr. Dunn and Pat, would you go ahead and forward to the last slide, and we'll show.
Oh yeah, sure.
Yep. Okay, there we go. So I know that I put my address in the chat box there earlier, but you can reach directly to the center or write to me one-off, and that is fine, and we will get back to you. Really excited that you joined us today, and would love to discuss your technologies and see where perhaps we can move this needle forward. That is my role as strategic business lead, is to discuss your technologies and see whether there is a potential fit. And to help you get to where you're going. So, Dr. Dunn, Pat, if you don't have anything else, and Cassie, I think she just typed in there. Please, she is our director for the Doctors with Heart program, and actually we have a new innovator that joined us in the last, last 60 days or so, and they have jumped on Doctors with Heart, and that's going to be an evolving program throughout the course of this year. So. That really is our thrust, is to develop new programs and bring to bear your technologies as they fit within the science of the American Heart Association. Well, Cassie and Pat, if you don't have anything else, I'll go ahead and close this out. And audience, thank you so much for joining us today. It's been our pleasure to bring this to you, and keep an eye out on the social media. We will be back and bringing you new topics and new guests. So thank you very much for joining us today.
Thank you, Dean.
Thank you, Pat. Thanks, Veronica. Azizi, thank you.